So I wanted to do a video talking about my favorite tool to use in vision therapy. So I don't do a lot of vision therapy, but I do a little bit. And so let's say you have a little bit of an eye turn, okay? So one eye turns in on us, we have something along those situations. Well, how do eye doctors want to fix it? Because if we have an eye that's turning in, if I patch it, it doesn't do me a lot of good. That eye's just going to be turned in. And if I switch and patch the other one, well, I'm just going to learn how to swap between which eye I'm using. And so we go to a device called a Brock string. It's basically a string with 5 different colored beads on it. And it uses a principle called the physiological diplopia situation. So I'm looking here at my finger here. I'll have 2 fingers back here. So if I focus on this finger, I see 2 back here. But if I focus on this finger back here, I see 2 up here now. Is because the eyes are working, and where they cross, we see 1. Anywhere in front of that or behind that, we see 2. And so what you do with a Brock string is you take it and you spread out the 5 different beads. So you attach to a doorknob or a wall or something, and then you hold it to your nose. And what you want to do is you want to look at the orange bead or the closest bead and notice that you're seeing 2 beads back here. So that tells me that both of my eyes are working and they're looking where I want them to. So then I jump to the green bead and I see 1 green bead. I see 2 yellow, I see 2 orange, and it tells me that I'm looking right there with both my eyes. Then I jump to the yellow bead. I notice 2 green beads, I notice 2 red beads, and then I jump to the red bead and I notice 2 blue, 2 yellow, and then I jump to that blue bead and do the same thing. So you just jump and walk all the way down and then walk all the way back. And what you want to do is work on being able to spread those beads out further. Get a longer Brock string and get to where we can coordinate to here, and we can spread that full distance. Because what we're trying to do is retrain our brain on where we're supposed to look at. Because what I hear from patients regularly is that the reason my eyes turn is because the muscles are weak. It's not a weak muscle. I'm going to do a video, and I'll link it up here, about strabismus, where I talk about how it's not a weak muscle. And so this Brock string is how we train that brain. And so we tell the brain where we're looking, are the eyes there, and we can check ourselves. If we're seeing 2 beads everywhere else, then it tells us that we're actually doing what we're supposed to. Whereas if I'm trying to look at this orange bead and I see 2 of them, but I only see 1 yellow, then I know that I need to reshift my brain and where my focus is and teach my brain where I'm supposed to look at. Brock strings are cheap and easy. You can get them from Walmart, you can get them from Amazon. Heck, it's just a string and 5 beads. You can make them yourself. So if you have questions, challenges with it, please leave it in the comment. I'll gladly answer those questions for you. If you want to have a more in-depth video about something, please leave that in the comments as well. Appreciate your time.